The World Health Organization estimates 16.7 million people around the world die of cardiovascular diseases every year. Particularly in developing countries, it is projected that 810 maternal deaths occur per day due to severe bleeding, infection, preeclampsia, eclampsia complications during delivery, and unsafe abortions. Specifically, it is estimated that preeclampsia is 7 times more prevalent in underdeveloped countries compared to developed countries. To detect preeclampsia and other cardiovascular diseases, blood tests are used. However, devices currently available on the market are expensive, bulky, and require large blood samples.
2 to 3 million patients are prescribed to take blood thinners in the U.S. every year. Some patients have to undergo blood clotting tests every day to every few weeks based on the blood thinner they are using. This device will allow for patients to monitor blood thinners from their home and to assure they are working properly. Approximately 500 million blood clotting tests are conducted every year. The growth in the market is restricted only by the cost of the test, along with the need for a skilled clinician to conduct the analysis.
Underdeveloped countries have further limited access due to the low number of skilled healthcare workers, high cost of available devices, as well as the large distance between the patients and medical facilities. A solution to this problem is a small and easy-to-use device that can detect proper blood clotting. Also known as a coagulation test, it gives the time taken by the blood to clot. This clotting parameter is significant amongst pregnant women with preeclampsia, liver disease, and people taking blood thinners.
It comes pre-packaged, and the overall size is similar to a microscope slide. A small sample size is required. Approximately the same amount of blood is required of a glucometer. It is injected into the device and flows through a microfluidic channel with an on-chip microfluidic vacuum pump. Typically, healthy patients' blood will clot on contact with the channel, or within 5 to 10 minutes. This way, disease can be ruled out if the clotting time falls within the accepted range. The chip itself only requires a phone to assist in the resolution of the photo to identify blood clotting.
A similar test can be utilized by patients who have suffered from heart attacks, embolisms, and stroke, especially when blood thinners are needed in order to monitor progress. Therefore, patients who may be located further away from hospitals or do not have access to expensive tests can still monitor their blood and check for diseases such as preeclampsia. A future prototype aspires to use image processing to calculate blood clotting time. The imaging software will be converted into an app similar to a heart rate monitor on health apps. This will give an automated blood clotting time, making the device independent of the user. This device has the potential to substantially lower the number of deaths from cardiovascular diseases and preeclampsia in underdeveloped countries by inexpensive early screening.